with Dr. Pacheco, and we are here today talking about a hospitalist, since Dr. Pacheco is a hospitalist. Dr. Pacheco, can you tell us a little bit about what does a hospitalist do?
Absolutely. So we are internal medicine and family medicine board certified physician that specialize in inpatient hospitalized care. And what that means is that we're there to take care of patients who are admitted to the hospital for non-surgical issues. So things such as cardiac disease, gastrointestinal disease, infections, a whole host of issues. And we work directly with the patient care as their primary caregiver. So that means that we're ordering tests, evaluating, making treatment plans for the patient. And what's important is that the types of problems that patients experience in the hospital-based setting is generally much different than those that are seen in a primary care setting. And so we have a better focus and we're training in those areas.
And I also know you've been with Vail Health since 2017. Mm-hmm. Can you tell us how being a hospitalist has changed within your team, especially during COVID and during the pandemic?
Sure. So overall, what I would say is that just as we know, our population in the Valley has grown a lot. So there's a lot more people, which means we've been busier. We've also, with the pandemic, had to deal with different issues and different medical problems that we've never experienced before. So there was a lot of hands-on and timely learning of how to treat COVID. So we did treat our patients in the hospital who were there sick enough to need hospitalized care for COVID.
And if I was a patient, what would be my experience with working with a hospitalist?
Absolutely. So what you would experience is that we generally take over patient care from the emergency room. So we will go down to the emergency room and visit with you, evaluate what is causing your issues, make a treatment plan, discuss that with you, and then take care of you through the course of your hospitalization. We do have 7 team members, and so occasionally you will see different faces among us, but we have a seamless coordinated care plan, and we communicate that closely within each other. We also work to coordinate your outpatient or your transition back to outpatient care, so we work to communicate with your primary care provider to know what to follow up on when you're done with your hospital stay.
Wow. Well, this is really informative. Thank you so much for taking the time to meet with us today.
Thanks for having me.